So people ask me often who might want to take a mental health first aid class. What is a mental health first aid class? And then what is the difference between the adult curriculum and the youth curriculum? So I'm going to address that today. Who might want to take a mental health first aid class would be a person that wants to feel more confident and calm in their skills and practiced in their skills of interacting and recognizing when someone may be having signs and symptoms of mental health illness or be in a crisis. A person who wants to be really clear on 5 steps to take to help people out in their life, and someone who wants to be a supportive community member or family member or better at their jobs in supporting their clients or their students or whoever is around them. So anyone who is working directly with the public could benefit from these classes, and that could be people working in hospitals, law enforcement, anyone in the airline industry, anyone who has customer service aspects of their job. It could be someone working with youth, so coaches, teachers, scout leaders, youth ministry, or just people who have mental health illness in their families or with their close friends or around their neighborhoods or in their grocery stores or post offices. You might recognize someone having some signs and symptoms that needs a little support or needs help getting to some professional help if they're in a crisis. So that's what this class is going to teach you. So it's an 8-hour course. It's very similar to CPR and first aid, where you get a certification. The certification lasts 3 years. It looks like this. It's nationally recognized. We use an acronym to teach how to interact with people. So just like the ABCs of CPR, you'll learn an acronym about mental health, and you'll get to take home a resource book that covers the general ideas, and it also has sections for specific mental health diagnoses and a crisis section in the back as well, which is really handy to have when you leave to take home. So you get all of that, and in the class we discuss pretty in depth about what is mental health, what are the signs and symptoms of mental health, so we're recognizing that, and then how to interact in a non-crisis situation with someone to keep yourself safe and keep them safe, and maybe encourage them to either seek professional help or just some self-care strategies or skills or activities in their community, in their area. And then in addition to that, so that's the non-crisis part, and then there's a whole crisis part about if someone lets you know that they're feeling suicidal, or if you wonder and you need to figure that out, or if you find yourself in a crisis situation and you need to get professional help immediately, what do you do? So we talk about that, so you're prepared to deal with all of those situations when you leave at the end of the day. And then the youth course focuses a lot on adults working with youth. So we spend time talking about what is developmentally typical for adolescents. And when I say adolescents, generally in the age range of 15 to 24 about. And so what is typical that might look like a mental health sign or symptom versus what is definitely a mental health sign or symptom, and how to tell the difference. And then in the adult course, we talk more in depth about specific illnesses and what they look like and what they might present like, not so that we could diagnose someone. That's not our job. We're not professionals in that regard, but just so that we understand a little bit more about what might be happening with someone, or how or who to seek help with or from. So that's how the classes will go. And if you feel like you would like to have more information and some more skills and feel more confident in these areas to help out your friends, your family, your clients, and just the people around you in your community, and strengthen them, please check out the link and join us for a class, and we would love to have you there.